Good evening to you. Adding more healthcare workers and paying them more. Ahead on the town hall, we zero in on those proposals and more that were part of the governor's State of the State today. A local hospital CEO will join us to discuss. Plus, better broadband. Some people don't have access to high-speed internet. For others, it's too expensive. So we'll look at the governor's plans on that issue as well. And suing the Jets and the Giants because they don't actually play in New York. Yeah, that is now in court, believe it or not. A lot of you are talking about it. We'll see if the case is frivolous. We have a big show ahead for you over the next half hour. We'll get to all of that, but we want to start with Storm Team 2 and the significant snowfall headed our way. The metro area is about to get pounded by a lake effect storm. Now, this isn't unprecedented, but we know the south towns and the southern tier are much more used to this type of lake effect snow. This time, the city and areas close by are kind of in the bullseye. Outside, as we look right now, no heavy stuff falling yet, but that will change. Road crews around the area have had plenty of notice, but they are also dealing with some COVID-related staffing issues. So we wanted to check in to see about preparations. So with that in mind, let's talk with Susan Surde with the New York State Department of Transportation. It's good to see you, Susan. It's been a while. I want to start here with the scene that really captivated the nation this week. Miles and miles of cars and trucks stuck behind jackknife tractor trailers on highways in Virginia, just outside D.C. Some people trapped there for almost 24 hours. And naturally, here locally, it reminded us of Snowvember in 2014 when we saw something similar. And also back in 2011 when people got stuck on our highways for a long time. I know that a lot has changed since then to keep that from ever happening again. We are not expecting a Snowvember type storm this time around, but we are going to get some heavy lake effect snow tonight and tomorrow. I wonder if you can walk us through what's different now compared to those past storms and what we saw in Virginia this week.
Well, keep in mind that in Western New York, we have the best snow fighting force in the country, I would say. What's changed in the last couple of years? I think every season we learn something new. We now have staging areas where we stage tow trucks. So we don't have those jackknife trucks blocking up and clogging our state highways. We now have emergency gates at the entrances to our major arterials and interstates. So we can effectively block off sections of highway if perchance there was an incident so that we don't involve more cars and clog more cars. So we're ready for whatever Mother Nature brings our way over the next few days.
Yeah, it's going to be interesting to see just how much we get, and we all know it varies community by community. Specific to the storm that we are going to get here, though, you talked about how the DOT is preparing. I wonder, do you have any new equipment or resources for this winter? And then if you can touch on that staffing a little bit more, because so many industries are facing challenges with so many people sick with COVID right now.
Right. Well, actually, this year, we've been using tow plows for the last, I'd say, at least 5 years. But primarily in the southern tier in Niagara County on I-190. But this year, we're actually using our snow plows on Interstate 290 and 990 in Erie County. So people in the metro area may encounter tow plows for the very first time this winter. And a tow plow essentially is a plow with another plow connected behind it that hydraulically swings out, and it effectively clears 2 travel lanes of snow in one pass. So that's a very effective tool that we have. And again, we haven't used that much in the Buffalo metro area. So that is something new that drivers are going to see this year.
Yeah, and our thanks to all of those drivers who we know are going to be out there. And good to know that, you feel like you have ample staff ready for this storm. We've been through it before, and we'll get through this one. Susan Surde is the DOT's Public Information Officer for our region. Thanks for coming on.
You're welcome.
And we'll get to your full forecast in just a little bit. Right now, though, to today's State of the State address, the first from new Governor Kathy Hochul. We've talked about some of the proposals throughout our broadcast this evening, but now we want to focus in on her push to help solve the state's healthcare staffing crisis. Among the proposals, a $10 billion pledge to boost the workforce 20% over the next 5 years, including pay increases, bonuses, tuition assistance, and stipends for workers who stay here after they finish school. There is a lot to it, and joining us live is someone who's had to deal with that worker shortage, Catholic Health President and CEO Mark Sullivan. It's great to have you back on, and I want to start by just getting your reaction to the governor's proposals and ask you, which do you think are most significant to Western New York?
Well, Michael, Happy New Year, and it's great to be with you. Let me start by thanking the healthcare heroes. And I think today, Governor Hochul did an outstanding job doing just that. She breathed life into a plan. As you know, we were the canary in a coal mine at Catholic Health back in the fall about the staffing shortages, about the worn out workforces, and our caregivers at the bedside needing assistance and resources. And today, the governor, in my opinion, hit a home run. It wasn't one faceted, it was multifaceted. She addressed staffing levels by encouraging people to get into the healthcare profession. She encouraged workers to stay here in New York State to work for our health systems by including retention bonuses. She looked at the pay for those healthcare workers. So she really looked at it comprehensively. And you need to know it wasn't just today. Our governor went out around the state with her executive chamber in the Department of Health and listened to executives like myself and others as to what will it take to fix healthcare in New York State? It's broken. And today was the first step in a long journey, but it was exciting to hear. It's a big, daunting task. As she said, it's a once-in-a-lifetime pandemic. It needs a once-in-a-lifetime response, and I think she did a great job today.
On the issue of the pandemic, we want to ask you about COVID right now. We've talked so much about the spike in cases. It's something we haven't seen at this level at any point in the pandemic. But we also focus a lot more on hospitalizations because it seems like with Omicron, it's maybe not as severe. But we are now kind of seeing our hospitalizations uptick a little bit more. And federal data, we were kind of looking through a database. It shows that there are very few, if any, ICU beds available at the Catholic Health hospitals here in Buffalo. Describe to us what it's like in the hospitals right now and how you envision the next few weeks playing out.
Well, we're going into our third year. I think our first interview was in April of 2020, Michael, when we were talking about COVID and we were trying to determine how to say COVID, right? Our healthcare workers are exhausted. The people in the ICU are not necessarily just COVID. It's important that the community realizes that people are in our hospitals that have comorbid conditions. We're in the flu season. We're in the spike of seasonal illnesses. That's on top of Omicron. So that's a challenge we have with our patients within our hospitals. So it's not just Omicron, it's also other comorbidities. And if you look at the spike for us at Catholic Health, and I'll get into the county a little bit, just a month ago, we were at 64 patients. And as of today, we're at 174 that have COVID. And that's a huge spike. I can tie it into speculation, though, into holiday gatherings, into football gatherings, into non-social distancing and non-mask wearing as part of it. But we also know that Omicron, its variant spreads more throughout the community, is more contagious. So, the workers took a deep breath. They're doing a great job at Catholic Health. We're so proud of them, but they're in their third year. So balancing what the governor said today, which was hope and healing that we're doing in Catholic Health, we're hopeful the community will step up and really focus on being a we community and not a me community and help us end this pandemic through all the steps that I just mentioned.
Yeah, hard to think. Approaching the beginning of the third year of this. We hope this is the last spike for sure. Catholic Health also operates nursing homes. We know that Governor Hochul also recently signed an executive order delaying a law that would have required more staffing and daily care for residents at nursing homes. It was supposed to take effect last weekend. I think this goes back to the bigger picture issue that we've been talking about and how difficult it is to have the staff in place. When do you think we get to a situation where that law can take effect, and what should we know about that change?
Right, for Catholic Health, we're very proud. We have 4- and 5-star facilities. So that legislation, in essence, we're already meeting or exceeding those expectations and those requirements within that law. In fact, we are paying workers to come in from agency to meet those ratios, and we've been doing that for years. So we would love to see reimbursement for those that have been there, but we also know that this is an effort to kind of raise the bar so all nursing homes will be performing at that. I think there's two things, Michael. I think we have to look at the short-term solution, and that could be increases in wages with subsidization from local health payers, from the federal government, state government, to get more people boots on the ground right now in the short term. And then I think that was outlined in the governor's address. And then on the long term is getting more people interested in healthcare. It's a profession that is rewarding. It's a vocation to many. And I think if the wages aligned and there's the support of the ministries and organizations I just mentioned, we'll have more people working there. And remember, our elderly, that's a generation, the greatest generation. We need to care for those people, whether it's in their homes, nursing homes, or in the hospital, and we need the workers to do that. But we're pleased at Catholic Health that we're already at that level, but we also know that we need to sustain that through collaboration with the groups I just mentioned.
Catholic Health CEO Mark Sullivan, great to have you on. Happy New Year to you as well, and I'm sure we'll talk soon. Thank you.
Yes, thank you, Michael. Have a good night.